Good afternoon and welcome to our 5 for 15 minutes of ABF Wellness segment, where we go over 5 questions in a 15-minute time frame. And today our focus is on leadership development. In this session, we have the privilege of speaking with Dr. T, a respected leader and mentor who has helped guide countless professionals towards stronger, more compassionate, and more effective leadership. Our discussion today centers around 2 crucial areas. 1, what to avoid when teaching and modeling good leadership, and 2, how to respond effectively to disgruntled customers, patients, or people in general. So let's dive right in. Question number 1. So Dr. T, what are some common mistakes leaders make when trying to teach or model good leadership?
Well, first of all, thank you all for having me out here today. It's definitely a pleasure being with all of you. To answer your question, one of the biggest mistakes is teaching leadership as a checklist instead of a mindset. We talked about that. Leadership isn't about memorizing what to say or how to act. It's about how you think and respond. For example, a leader might say, always keep your door open, thinking it promotes approachability. But if they're glued to their phone, and we are all glued to these things all the time now, when someone walks in, they're teaching the opposite. The present is optional. Leaders should model what they expect, not just talk about it. Consistency between message and behavior builds trust. Inconsistency destroys it faster than any policy can fix.
And question number 2, what are some things leaders should avoid when giving feedback or correcting behavior?
Well, I always say avoid the public praise, private punishment trap, but also avoid the reverse of that as well. Many leaders think tough feedback has to be harsh or dramatic, and that's false, totally false. Feedback should never embarrass or belittle someone. Instead, focus on behavior, not personality. For example, instead of saying, "You're not a team player," say, "I noticed you didn't share the patient update during our meeting." And, I speak of patients because, we're in healthcare. So, doing that. Or how can we ensure that information flows next time? This approach invites ownership without shame, because we don't want to feel shame, and it shows respect while still maintaining accountability. Well, we have to make sure we're holding each other accountable for the things that we're doing and saying, but we can do it in an effective manner without, again, belittling or bringing someone down.